Bob. So yeah, here we are. Hopefully I don't have to say a word. I'm on vacationing at home.
Oh. Lucky.
Yeah. And
you're lucky in the sense that you're going somewhere.
Bring down your audio. Your microphone is way too loud.
So the computer one?
Your microphone is Zoom. There's a control. If you click on one of the arrows for audio settings in Zoom, you should have, there's a speaker and a mic lever. You just need to bring down the lever for your microphone.
I don't see, I have mute, stop video, participants, share screen.
Next to the mute, there should be an arrow. If you click on that arrow next to the mute, it should show you video settings, audio settings.
Audio settings?
Yeah, and audio settings, and then
microphone
down
is all the way to the bottom.
You uncheck the mark that says auto, and just do that. And then I'm sorry, I have 30 seconds before we go hot in this room, so I have to stop talking.
All right, is that better?
That's you're still too hot, but if you can bring it down a little bit more, that'd be better. No. Bring it up higher.
How about that? Is that better?
That's better. Okay. Exactly.
All right, ladies and gentlemen, I'll call this meeting to order. And as we have been doing in the past, my fellow council members will be teleconferencing in. And let us all stand for the Pledge of Allegiance. Here we go. If you put your hands over your hearts, please. I pledge allegiance,
to the flag
of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you very much. If you give us the roll call, please. Ms. Rodriguez?
Councilmember Engler?
Here.
Councilmember Jones?
Here.
Mayor Pro Tem Bill De La Pena?
Present.
Mayor Adam?
And I'm here as well. And per usual, the city attorney and the city manager and myself are 8 feet apart, if not even a little further, so we have taken our masks off, but I can assure you we wore them in, we'll wear them out, and we wear them as we're walking around the building here. All right, we do have a request for continuance. It looks like the item 8A, the leaf dispensary, has been continued to a date uncertain. May I get a motion for that continuance, please?
Also move.
All right, thank you. And if we could have a vote on that, please. We're doing a voice vote, right? Okay.
Councilmember Engler?
Yes.
Councilmember Jones?
Aye.
Mayor Pro Tem Bill De La Pena?
Yes.
Mayor Adam?
And that's yes for me as well.
And that motion carries 4-0.
All right, thank you. Now let us go to Mr. Powers for our COVID-19 update.
Thank you, Mayor Adam. I'm going to have a relatively brief update this evening, as I'm sure most folks are tracking things fairly closely in the news, given the coverage. The COVID-19 situation in Ventura County has devolved pretty substantially in the last 2 weeks. There continues to be significant concern amongst our local public health leadership. Just to give you a sense on numbers as to where things stand tonight, in total, we now have 3,858 cases. That's an increase of almost 1,700 cases since my update 2 weeks ago, just to give you a frame of how the numbers are growing. We now have 50 fatalities. That's 7 additional deaths in 2 weeks. And a total of 76,400 tests have now been performed across all the testing sites. The area of most substantial concern is in the hospitalizations and those in ICU within hospitals. Today we have 79 individuals hospitalized across the county, and 31 of those are in the intensive care unit. And just to give you a sense, that's an increase of 28 hospitalizations in 2 weeks and an increase in 17 in the ICU in 2 weeks. It's a big concern. That's the main focus is to try to control the spread, in particular to protect those that are most vulnerable, but to also protect our hospitals in that capacity. VCMC, Ventura County Medical Center, we understand is already in surge capacity right now. Los Robles remains stable. I was in contact with their leadership today. They obviously are dealing with COVID patients, as all hospitals are across the county, but Ventura County Medical Center is the most inundated right now in the county. These are by far the highest hospitalizations and ICU rates that we've had in Ventura County during this pandemic, and it should be a cause for concern for everyone. Numbers are tracking across the state in the highest percentage increases that we've seen since the beginning of the pandemic. And so this uptick is concerning, it's worrisome, And we just ask everyone to be really extra vigilant and mindful and thoughtful, and understand that there is actively spreading virus across Ventura County. We're also, in the same arm, continuing to work to try to support businesses through grant programs, affected businesses through the reopening process, and managing a closure process that went into effect over July 4th weekend for some aspects of those businesses. It's a huge challenge for our business community to have to throttle up and throttle down, and then for our city staff to have to try to support them. The number one thing we can do for our economy and for our businesses right now is to try to control the virus, so that we can get back to a place where we can continue to advance these reopenings. So I just ask that when you're out and about, there is a state order on masks and you're visiting businesses, please be thoughtful about that, and try to contribute and do your part. There's a lot of folks working on the front lines to try to combat the virus, and we certainly want to keep people safe and to keep our economy moving forward. As I always state at the end of my comments, vcemergency.com is the resource where data is updated daily. Those that need testing have access to testing free of charge, locations across the county. The county's working very hard to shorten the time frame for receiving those results, working to provide text message access to those results, and they're continuing to focus on that. Their testing capacity has ramped up substantially. Last week saw some records for daily tests, so there's a lot of volume flowing through those testing sites. And if you need access to where those are and how you can get to them, vcemergency.com is the best place to go. That will conclude my update tonight, Mayor Adam.
Thank you, Mr. Powers. Yeah, as you can see, we have gone a little bit backwards on our number of cases. Not all that unexpected, but it's happening nonetheless. As I make my way around town, which is really on a limited basis under the circumstances, I do see the use of face coverings to be fairly universal at this point, so please keep that up. It's the only thing that we can do as individuals, or one of the things we can do as individuals to stop the spread of this virus. And keep your distance from others, and stay away from those large gatherings. That seems to be a hot spot. Family gatherings in the backyard, barbecues, that kind of things. It just we gotta forgo that for now, because we want to see you protected, and we want to see your family members and your residents protected. So, and then as Mr. Powers mentioned, this has been tough on our local businesses. So support them when you can. It means a lot to them and their survival and into the future. So,
Mr. Mayor?
oh yes, Councilmember Jones, how are you?
Yeah, may I ask a question of the city manager? I couldn't quite hear your last few remarks. Did you mention where Thousand Oaks stands in the county in relationship to the new cases and hospital ICU deaths, et cetera?
So the data is not broken out on hospitalizations and ICUs in that way. But
could you speak just a little louder, please?
Sure, Councilmember Jones. The data is not broken out for hospitalizations and ICUs by city, but in terms of cases, Thousand Oaks has 390 cases attributed to the total, and Oak Park, which we sort of, while unincorporated, we consider adjacent to us, has 36 cases.
I see. Well, I don't do a lot of moving around the city right now, but I don't really see gatherings anywhere. I think our residents are being very cooperative, as far as I can tell, in social distancing and wearing masks. I think it's just very unfortunate that we seem to be having this surge right now. It's hard for me to understand. You know, you seem to do everything right, and still you have a problem. It doesn't seem quite fair. But That's the way it is, I guess.
If I might add, we do have, the county does have a contact tracing teams. They have about 100 folks that are working in that capacity. And when you are test positive, those folks are in touch with you, and they are the ones that help run to ground the contacts that you've had. In a number of cases, as Mayor Adam mentioned, these are rooting back to gatherings, and some of those are gatherings that occurred around graduations, around Memorial Day, and other types of gatherings. A lot of them family-oriented gatherings. Some of those are parties, and that is happening. There are numerous other avenues of spread, but I think the main focus is the virus is highly contagious. There is a lot of new research that public health officials are focused on right now that indicates the virus has mutated in a way that makes it increasingly contagious, easier to spread, and so that's certainly a cause for concern, and really calls for everyone to just practice that vigilance.
Thank you.
Yeah, as far as these gatherings go, it only takes one person in a gathering of 10 or 12 people in your backyard, and that could be the big difference. So it's wise to just forgo those for now. And Mr. Powers, our testing sites are, we have one in Newbury Park, I believe.
Yes, there is a location that is at the Newbury Park Branch Library. There's also locations across the county. VC Emergency has a little map up there where you can see the locations. Some of those are walk-in locations. Others are drive-through locations. Moore Park College has a drive-through location. Ventura College has a drive-through location. And so those are sometimes more convenient and comfortable for folks to just drive in and wait and not have to get out of the car.
Describe the Newbury location. Is that drive-through?
That location is a walk-in location. It's a state-run location. And so you come in and receive the test and go out another door.
And is that open, what are the hours? Do you happen to know?
I'll have to look it up really quick. Those hours are up on the VC Emergency website.
All right.
But
Very
I will
good.
take a look and confirm for you.
So if you want to get tested, you could do it as close as Newbury Park. Okay, let us move on now to the consent calendar. Do we have anything to pull?
Mayor, public
Mr.
comment.
Mayor,
I think I heard Mayor Pro Tem first. Oh, no, I beg your pardon. I missed public comments. Doggone. I'm going to get that right. Let us announce public comments. Ms. Rodriguez.
This is a time and place for public comments for those wishing to address the City Council regarding items on the agenda or on a subject within the city's jurisdiction. All remarks should be addressed to the council as a whole. Speakers are requested to state their name and community of residence for the record. Under state law, public comment matters may not be considered by the council unless listed on the agenda, but may be referred to the city manager for administrative follow-up. 7 individuals have requested to speak, and pursuant to council standards, speakers are allowed 3 minutes.
Thank you, Ms. Rodriguez. Well, first up from Conejo-Reckon Park District, we have Mr. George Lang.
Thank you and good evening, Mayor Adams and honorable council members. As noted, my name is George Lang, and I happen to be the chair this year of CRPD. And it's my pleasure to, along with all the park and rec districts in the nation, to announce that the month of July is Parks and Recreation Month. And hopefully you all received a little flyer that talks about 6 different items that make your local park district one of the best in the country. We are strong, we are confident, we are selfless, we are passionate, we are driven, and we are essential. We are strong, but what makes us stronger is the great participation with our fellow local government agencies like the city and Conejo Valley Unified District. And we all work together to face whatever challenges that the community has been presented with. The community has a level of civic management and public participation which allows CRPD staff and volunteers to work with the residents, businesses, and community institutions in common cause and achieve great success. We have a number of great successes locally. Recently, Sopway Trails was one. Our Safe Passage program that deals with at-risk children. We are confident. We are confident for a number of reasons, including having been recognized by national and state level organizations as a top rec and park district. We have built a robust recreation and park and open space system with over 60 parks and facilities, plus our association with COSCA, the partnership with the city. We manage approximately 15,000 acres of open space and 150 miles of multi-use trails. Plus, every year, normally, we offer thousands of recreation programs and dozens of community events. But as you know, COVID-19 has impacted those efforts. We hire future leaders, smart young adults, to work with our kids in programs and create confidence and well-adjusted youth. Selfless. In our city needs, if our city needs something, we jump in and try our best to meet those needs. This happens it happened in the aftermath of Borderline and the fires. And now during this pandemic of COVID-19, we have to continue to maintain and update operate the parks and have offered summer day camps to support working families. We work hard to bring at-risk youth into productive programs. We serve senior meals and we offer homework clubs in the low-income areas. Passionate, we are passionate. We care deeply about our environment in the natural sense and in the way one's surroundings and experiences shape the human spirit. We serve our community by offering well-maintained parks and trails, as well as quality, enriching, and fun programs at reasonable fees. We have wonderful dedicated staff that are passionate about their jobs and how their work can enrich the quality of life for those participants.
George,
in many programs.
George, I want to thank you so much for your service on Conejo Rec and Park Board. You've devoted many, many years, and you've been a wonderful addition to that board. And thank you for that report this evening. Next up, we have Deborah Baber. Deborah? And we're going to move on from Deborah to Judy Bruce.
Okay, can you hear me?
We got you, Judy. Hi.
Oh, hi. Okay, the so-called surge in case numbers are inflated and meaningless. The deaths have dropped. There is no emergency. The hospital numbers are due to, they're taking in people from south of the border. The case numbers do not mean sick or have infections. The tests are inaccurate. They cannot detect a virus. Some are tested more than once and counted again. Even people who are not tested are counted as tested positive. Here's a tweet from Texas. My parents' friends went to get tested. They waited in line for 2 hours and then decided to leave without getting tested. Hours later, they got a phone call saying they tested positive. This is an epidemic of false testing. The entire charade of, quote, cases, statistics is theater, not science. And why did public health official Vargas ignore my request to provide context to his meaningless data comparison chart? Very telling. Now, let's blow the whistle off of contact tracing, shall we? Is contagion a myth? Well, ever wonder why they have to stick a Q-tip up your nose to the back of your head to swab a sample of COVID, but a droplet of saliva will infect a whole village at one time? In 1910, tens of millions died from the so-called Spanish flu, but there was never any evidence that there was a contagion, and even though there were flu-like symptoms. The 1918 radio wave era meant that the electrical field of the Earth was very much disturbed, and along with that, the electrical circuits in the human body. And of course, Western medicine ignores the electrical nature of living things. And also, by the way, millions died from forced vaccinations. Public health officials really wanted to prove that the Spanish flu was contagious. They tried to infect 100 healthy volunteers by collecting mucus from the noses, throats, and upper respiratory tracts of those who were sick. They transferred these secretions to the noses, mouths, and lungs of the volunteers, but not one of them got sick. Blood of the sick donors was injected into the blood of the volunteers, but they remained stubbornly healthy. Finally, they instructed those afflicted to breathe and cough over the volunteers, but none of them became sick. The Spanish flu was not contagious, and it's a fact. Up to this day, there has been no observable experimental studies proving that the influenza is ever transmitted from person to person by normal contact. All attempts to make it contagious have failed. In fact, each new electromagnetic technology was accompanied by a significant flu pandemic, and each time the public was hoaxed by phony attempts at vaccines by Big Pharma who knew they wouldn't work.
Thank you, Judy.
So,
Thank you very much. And we're going to go to Dolores now.
Thank you very much for this opportunity. I'll just begin. In 1965, scientists identified the first human coronavirus. It was associated with the common cold. As the news of deaths in China began to saturate every form of media 24/7, we became familiar with a new term, COVID-19. To be clear, the government media basically relabeled the existing SARS coronavirus, which is short for Severe Acute Respiratory Syndrome Coronavirus 2. The symptoms are fever, cough, chest pain, and shortness of breath, which form the diagnosis of the alleged new COVID-19. Calls for testing was declared, but the test became problematic for a variety of reasons. First, those test kits developed by the CDC had a defect. The testing agent reacted negatively to the genetic material, which made the test inaccurate and the kits unusable. Plus, the kits are clearly marked not for diagnosis purposes. Second, thousands of test kits were contaminated with the SARS viruses. Would the test return a false positive, driving up the numbers so those in power could implement stronger lockdowns and increase unemployment rates? Mandatory testing of what? It is claimed that testing is important to assess if their mitigation efforts, such as shelter in place and social distancing and wearing a mask, are making a difference to flatten the curve. Officials also claim that testing is necessary to know how many persons are infected within a community and to understand the nature of how the coronavirus is spread. Well, I don't consent to be a test rat, frankly. Are these reasons sufficient to give up our health freedom and our personal rights, being tested and shamed in public? Despite the problems with test kits, testing began. By the end of March 2020, more than 1 million people had been tested across the U.S. The call for mandatory testing has been gathering steam and becoming ever more onerous. But what do the results really mean? Who should be tested? High priority is one category. With symptoms, hospitalized patients, healthcare facility workers, and residents in long-term care facilities. The second category, priority, persons with symptoms or without symptoms for any reasons. That means virtually everyone can be required to take a test. Is that not a violation of our personal rights? And if you submit to testing, what does a positive test actually mean?
Thank you, Dolores. Thank you very much. And next up, we have Lorena Saruwatari. Lorena?
Here.
There we are. Hello.
Can you hear me?
We can hear you.
Thank you. Good evening. COVID, behind the global nursing home disaster and the case numbers come. Scandal, tragedy, ongoing crime. In nursing homes, elderly people are suffering from long-term illnesses and years of toxic medical treatments. But now you terrify them with COVID propaganda, and you actually label them COVID without no justification. And you isolate them completely. They are all alone, no contact with family and friends. What do you expect will happen to these fragile, heavily drugged people? My findings on the pandemic, an unproven claim of having discovered a new virus, diagnostic tests which are worthless, but open the door to the phony escalation of case numbers, the gathering and corralling of people who have different traditional diseases, and perhaps a few new non-viral conditions. Under the meaningless umbrella term COVID-19, the plan to introduce a toxic vaccine as a solution. There are two con jobs going on here, as huge numbers of these elderly patients have died and are dying. The first is the COVID-19 diagnosis, which is either made on the observed basis of simply eyeballing the patient and seeing general signs of illnesses such as shortness of breath and flu-like symptoms, or by tests which I have explained is completely unreliable because you register positive on all sorts of germs in the body that are irrelevant. But once the COVID diagnosis is made, the medical authorities claim the deaths of so many patients in nursing homes are occurring because COVID virus naturally has more impact on the elderly and infirm. Nonsense. There is no need to invoke the coronavirus to explain why these people in nursing homes are dying. Plus, filthy conditions in some facilities, plus inattention and outright brutality on the part of nursing homes staffs. Plus, breathing ventilators and sedation in some cases. Not a virus. No need to invoke a virus as an explanation. No need at all. Obviously, if you subtracted all the deaths from an official COVID statistic, you will have a completely different picture of the so-called pandemic. You will have a worldwide nursing home disaster, but because of the fake COVID diagnosis immediately leads to locking down the facilities, friends and families can come in. They are shut out. For the planners of this fall pandemic, it all works out. COVID deaths numbers rise, deaths number rise, only numbers to the core. But real and tragic deaths, people push into deaths by the concocted idea of a virus, a story about a virus. Thank you so much.
Thank you, Lorena. Next up is Stephanie Sellers.
Good evening, and thanks for the opportunity to speak. Testing is fraught with serious problems. Testing for COVID-19 has serious problems, such as testing cannot directly detect any virus. The PCR, or polymerase chain reaction test, and antibody testing can only test for respiratory remnants and effects caused by our immune systems. These are assumed to be viral in origin. This is stated by experts as well as the documentation for the test kits, which states, quote, not for diagnostic purposes. The test results, including the antibody tests, are not sufficiently viable. They are all flawed, just estimates and based on physician opinion. Many of these tests do not work or are inaccurate for mass screening, with 50% risk of false positives. An unknown number of test kits are contaminated with the SARS-2 virus, thus bringing into question the very motivation of mass testing. Was it to spread the disease, like the American colonists providing smallpox-laden blankets to decimate the Native American populations? There are dissenting professional voices. A growing number of dissenting professional voices, far too numerous to list here, are questioning all aspects of this pandemic, from the highly qualified epidemiologist, Professor John Leonidas. The current coronavirus disease, COVID-19, has been called a once-in-a-century pandemic, but it must also be a once-in-a-century evidence fiasco. The data collection so far on how many people are infected and how the epidemic is evolving are utterly unreliable. Reasonable estimates a case fatality ratio in the general US population vary from 0.05% to 1%. If that is the true rate, locking down the world with potentially tremendous social and financial consequences may be totally irrational. Pressure is on people to be wearing masks in what amounts to be a mass humiliation ritual, representing the quashing of free speech, the muzzlement of humanity. This is even through the clinical research shows that constant wearing of masks is more likely to cause infections, with the US Surgeon General and the WHO now saying not to wear masks. Yet arbitrary and confusing regulations are being enforced on people to wear them around the globe. Draconian laws are being drafted and passed around the world, both for mandatory vaccinations and for a quote unquote new normal base for social norms, in direct violation of natural human rights and behavior. Viruses are the most abundant microbes on the planet, in our air, soil, and water. They are messenger molecules congruent with exosomes and other extracellular vesicles. Our life processes are totally dependent on them. To even consider vaccines as some sort of savior against a single virus may someday be seen as ignorant and medieval bloodletting. True science evolves with the best information available, not to be held back by dogma.
Thank you, Stephanie. Thank you very much. And we have Shirley Lang with us by phone. And we're
Hello, can you hear me?
We hear you, Shirley.
All right, sorry, my camera's not working today. So thank you very much for allowing me to join. On a final note here, across the nation, police are being told to not apprehend criminals, but instead to arrest parents on playgrounds, to arrest lone surfers on public beaches, to find ministers and congregation members sitting in their cars, listening to a service on the radio, etc. People have had enough. They're beginning to see the huge scam this has penetrated in the entire world over a viral infection with a global death rate of 1.4%, meaning 1.4% of the people infected with this SARS-2 have a fatal outcome, while 98.6% recover. This is far fewer deaths than a severe flu season. We're already starting to see the thrust and take our power back. In Virginia, for instance, people went to beaches ignoring en masse social distancing, the orders of the governor to stay home. The Central California city of Atwater declared itself a sanctuary city, allowing business owners and churches to openly defy Governor Newsom's stay-at-home orders. The truth about wearing masks is starting to come out, and people are voting with their feet. Retired neurosurgeon Dr. Russell Blaylock warns that not only do face masks fail to protect healthy people from contracting illnesses, but they create serious health risks to the wearer. I also heard Dr. Fauci kind of laughingly say, oh, forget face coverings. They're not going to work in a pandemic. And here, this is a guy we're listening to who's gone back and forth between wearing one or not wearing one. We had 2 weeks to flatten the curve. Well, the curve is flattened, and I don't believe all these new numbers, but that we're increasing the testing, yes, but with more increasing, there's going to be more cases. It doesn't mean people are actively infected. The death rate is actually overall going down. And this is just getting ridiculous. I'm seeing businesses suffer. I had a girl almost in tears talking to me, waiting at Bed Bath & Beyond as a single mom, worried that with all this going on, she's going to lose her job again. There's just so much. I see the restaurant owners at, just a quarter of their capacity. They've been shut down, all their blood, sweat, and tears, and they're not able to even, make half the money that they made before, to say nothing of their employees. I'm not willing to accept this new normal because there's nothing normal about it, and it's wrong to even consider it. Definitely refuse mandatory vaccination, and I won't wear a mask. And I'm not afraid to stand next to family, friend, or members, and the concept of social distancing. I'll respect my friends that want to, not hug and stay away. If anyone else wants to wear a mask, by all means let them, but it should not be mandatory. And I also understand that as an asymptomatic carrier, as a normal, healthy person, and I will not buy into the fear I might catch something. I mean, every year we subject ourselves. It's a flu. It's a doggone flu, for Pete's sake. If you're sick, stay home. If you want to wear a mask, stay it. Big surge in cases are meaningless and a falsehood. There's the gal before me, Stephanie, mentioned the competing opinions. There's lots out there.
Thank you, Shirley. Thank you very much.
Please consider our comments. Thank you.
Thank you. And I believe that's it tonight for public comments. Yes. Let us move on to the consent calendar. Is there anyone that would like to pull an item?
Mr. Mayor?
Councilmember Jones.
Yeah, I'd like to talk a little bit about 7D,
7D.
7J, and 7M.
D, J, and M. All right. Can I get a motion for the balance of the consent calendar?
Mr. Mayor, Bob Engler, so moved.
All right. We have a motion for the balance of the consent calendar other than D, J, and M. Can I have a vote on that, please?
Councilmember Engler,
Yes.
Councilmember Jones,
Aye.
Mayor Pro Tem Bill De La Pena,
Yes.
Mayor Adam,
And that's a yes for me.
and that motion carries 4-0.
Thank you. Well, shall we start with D, Councilmember Jones?
Yes, Mr. Mayor. We've had at least one complaint about the larger helicopters by one of the neighbors. And I know that the report said there had been a sound study. I just wondered if maybe Mark, I see that Mark Town was the go-to person on 7D. Maybe he'd like to expand on that just a little bit.
Mr. Town or Mr. Powers, either one, I think, has
Mr.
knowledge
Town,
about that.
his question was regarding the sound study on the helipad item.
Sure. And Mr. Mayor, this is Patrick Heher,
Oh, there
one of
he
the
is. Patrick's
city
here.
attorneys.
Oh, all right.
We also have 6 individuals or a number of individuals from the consultant firm from the hospital that are on Zoom for this particular item, if it was called. Briefly, I can say that there was a sound study done just because it was a larger helicopter, but based upon the study that was done, the hearing officer who heard the matter did not find any change that was necessary and therefore moved to approve the project. And so that project was approved administratively. So there was a hearing and there was a study done, a sound study done, but it showed that there wasn't too much of a change due to the limitation of the helicopters that are going to be going to this location, the Firehawk helicopters. So I'm not sure if that answers completely.
All right. No, that's fine, Mr. Heher. And Mr. Powers, I believe you shared with me the average number of flights each year that would be?
Yeah, I had the question posed just to give the council a sense. 2019, they had 14 Ventura County fire helicopters landed 14 times at Los Robles.
So we're talking just slightly over one flight a month, correct? All right. Mr. Jones?
So the decibels were in an acceptable range, is that correct?
That is correct.
Okay. On 7J, I just would like to review this process for a moment. These are very large contracts. And I know the staff report said that there is a committee that goes through these. I believe it's quite a large total sum and for a 5-year period. I was wondering if I see Jamie's name is on this, or whomever would like to explain a little bit the process, since we are talking about very large contracts here.
Sure, Councilmember Jones, while we're pulling the right staff person up on the screen, just to reiterate, we have existing processes and procedures for review of RFP, RFQ, bid processes, but I'll let them speak to the specifics of this one, which is in regard to janitorial services. Liz Perez.
Okay, good evening, Councilmember Jones. This is Liz Perez, Facilities Manager. So we went out for a formal request for proposals, and because janitorial covers so many facilities, we actually had a committee of 7. So we had representatives from the Hill Canyon Treatment Plant, the service yard, library, 2 from theaters, plus City Hall staff. So we had a very large committee. We interviewed, I don't know, 3 or 4 companies. And this is the one, EFS. They actually worked with Caneo Park and Rec District. They came with really great references, and they were slightly higher than our current budget, but that was one of the reasons we actually went out for an RFP, is because with minimum wage going up, a lot of the pricing was going to go up. So we decided it was a good time to go out and see what was out there with new companies. So we went through the formal process, checked references, and EFS was the one who came on top. The number does shock people, but it is over 13 locations with multiple buildings, over 300,000 square feet of cleaning. So that's a lot of space to clean. The numbers also looks high because this includes all janitorial at all facilities. Cavley is closed and Forum, so of course there won't be any theater expenses till January probably. Newbury Park Library is closed, but we did put that numbers in the staff report and the budget just in case. You never know what might happen, so we want to make sure that we're covered in case those buildings are able to open up earlier. So went through the formal process. This was the firm that came to the top, and if you have any other questions, I'm here to answer.
Have we had any experience with this firm in the past?
The city hasn't in particular, but I think the Park District has worked with them for many years, many years.
Well, it sounds like a very thorough process, and I just, if we're going to do it for that period of time and involving not much money, I just want to reassure myself and the public that we're doing the best we can to get them, the best conscientious type work for the best price. So that was my only question. Thank you about that.
Okay, great.
And
I have one more item, Mr. Mayor.
yes, M.
That's M. I just wonder, this balance that we have left over from the public authority we used to have, I noticed is $8,790,000. Do I understand correctly that the tax increment is going to continue relative to any debt that is left in these facilities from the time they were discontinued? Is that still going to be paid by the tax rate, or do we have to use any sources of funds to retire that?
Ms. Boscarino can answer that question for you.
Good evening, Mayor Adam, council members. Mr. Jones, to your point, as long as the debt is outstanding, the tax increment will be going to pay off the debt. Once the debt matures and is no longer outstanding, then that tax increment will then be redistributed out to all of the entities that receive the property tax for the city, including CRPD and the fire district, school district, and the city itself.
Is that true of all of the redevelopment agencies? When they were discontinued, they still had access to that tax increment long enough to pay off what existing debt still was there and needed to be paid?
That is my understanding of the law.
I just wanted to make sure we didn't have to dip into the general fund to take care of what whatever was left from the redevelopment agency.
No, we certainly will not.
All right.
Thank you.
All right, very good. Well, Mr. Jones, would you care to move D, J, and M?
I'll move 7D, 7J, and 7M.
All right, motion on the floor. Vote, please.
Councilmember Engler?
Yes.
Councilmember Jones?
Aye.
Mayor Pro Tem Bill De La Pena?
Yes.
Mayor Adam?
Yes.
And that motion carries 4-0.
Thank you. All right, we have a department report this evening on our solid waste franchise request for proposal. And Dr. Helen Cox, our sustainability manager, will give that report. And I think it's great that we have a sustainability manager here in the city of Thousand Oaks. Microphone.
Thank you, Mr. Mayor. Good evening, and to members of the council. I'm here this evening to provide an overview of the request for proposals for solid waste service in the city, and I'm joined on the dais by Cliff Finley, Director of Public Works. Our consultant, Richard Tagore Irwin, President and CEO of R3 Consulting Group, is joining us by video conference. Council set the development of a sustainability strategic plan as one of its top 10 priorities for this fiscal year. A key component of this addresses how our waste is handled. As Council directed earlier this year, staff, in consultation with R3, have developed a request for proposals, or RFP, for an exclusive solid waste franchise to serve the city. We're here tonight to present an overview of that document and seek your approval to issue this solicitation. One of the key elements of the new waste services will be the provision of organics recycling to all residents and businesses. This is a requirement under the state's new law, SB 1383, which becomes effective at the start of 2022. For residents, it will mean adding food waste to existing yard waste carts. Haulers will need to arrange for processing at permitted organics processing facilities. Almost all businesses will be required to subscribe to organic service. This is new. Currently, businesses that generate less than a large cart's worth of organic waste per week are exempted, but under new law, exemptions are virtually eliminated. To ensure that the city is in compliance with the state's laws on mandatory commercial recycling and mandatory organics recycling, business service will be bundled under the new contract. Businesses subscribing to solid waste service will receive a garbage bin, a recycling bin of the same size, and an organics cart. They will also have the option to modify the basic bundle package to meet their needs. Residents will continue to receive the same basic bundle service that they currently receive: a 64-gallon garbage cart, a 64-gallon recycling cart, and a 96-gallon green waste cart, to which they will be able to add food waste. Under the new contract, residents will receive new carts that are in standard colors: black or gray for trash, green for organics, and blue for recycling. Commercial bins will all be newly painted in these same standard colors. This will provide consistency throughout the city and also consistency with most other cities. Contractors will be required to use clean fuel vehicles to reduce their impact on emissions, and vehicles will be equipped with technology, including GPS for locating and tracking vehicles in real time, and cameras for recording the contents of loads. This will be necessary for monitoring contamination of recycling and organics containers and help the city to meet the strict compliance requirements. The contractor will be required to conduct extensive outreach and education on organics and recycling to all residents and businesses, with a focus on helping everyone to understand how to recycle properly. The contractor will also be required to conduct site visits to all businesses and multifamily complexes every year. The contractor will be required to maintain a minimum recycling rate, which is established by the city. This is based on the material that the hauler collects and diverts from the landfill. This will help the city to meet its state-mandated diversion rate. The selected contractor must provide residents with 3 free landfill day events annually. These have always been popular with our community. In addition, we're adding recycling bins to our public trash bin locations throughout the city, and the contractor will service up to 90 of these locations. The contractor will be required to offer employment to all qualified displaced employees of the city's current 2 franchisees. Contractors must retain these displaced employees for at least 90 days. The current practice of street sweeping will continue under the new contract. Under the RFP, proposers will submit proposals to provide home collection of household hazardous waste quarterly to residents. The cost of this program will be included in the service rates. The city will have the option of whether or not to include this program in the final agreement. Additionally, proposers will be asked to submit their proposals for cleaning out the city's storm drain inlets. The cost of this service will be folded into service rates, and again, the city will have the option of whether or not to include this program in the final agreement. A single citywide service provider will result in the best value to the city ratepayers because it will minimize service costs and maximize efficiency by avoiding duplication of services, by optimizing vehicle routes, and by reducing overhead costs such as administration and billing. It will also provide for the highest accountability by holding a single entity responsible for reporting, compliance, and meeting diversion standards. And it will provide citywide consistency for services, scheduling, rates, outreach, and customer service. The evaluation process for proposals includes an initial pass-fail review, followed by a detailed evaluation and scoring by the evaluation team, based on a number of criteria, including qualifications, financial resources and stability, technical approach, plans and schedule, sustainability, diversion, outreach, customer service, and rates. The planned schedule is as shown here, with the RFP to be released next week, a proposal due date of October 15th, an award recommendation to be brought to council in early spring 2021, and new service to begin January 1st, 2022. That concludes my presentation. Thank you. We're available along with our consultant to answer your questions.
Thank you, Dr. Cox. And just a quick point of clarity. Residents may be wondering, why can't I just throw my organic waste in the garbage like I've always done, whether it be banana peels or vegetable remnants, whatever that happens to be. And here's why. Because right now, those remnants end up in landfills in which they decompose and they create gas. I believe it's methane gas, which then seeps out of the landfills into the atmosphere and becomes a greenhouse gas that contributes to global warming. And as you can imagine, with all these landfills all across the state, this is significant, this amount of this gas. So the state of California, I think wisely, has said that by 2024, we're not going to do that anymore. We're going to recycle these materials, either through composting or a number of other different methods. Did I get that right, Dr. Cox?
Yes, you did.
Okay, very good. So we live and learn as we go along in this process. Now, with that, if I may, I'd like to see if my fellow council members have any questions.
Mayor Bob Engler here.
Councilmember Engler, hello.
Thank you. Dr. Cox, I'm wondering, in terms of how we're going to make this choice, there's some vendors that have very distant landfill dumps or very, very distant recycling areas. Is that going to be part of our evaluation, the amount of energy it's going to take to move our trash to locations, or is there some feel for that you can give me?
Yes, that will be part of the evaluation. One of the criterion will be looking at the facilities that the proposers are proposing to use for disposal and for recycling and for organics processing, and the footprint that's associated with the traffic going, the vehicles going to those will be part of the consideration.
Thank you.
All right, Councilmember Engler, anyone else?
Mr. Mayor?
Mr. Jones.
Yeah, I just wonder, in this whole process, at this point in time, should we try to give some guidance in this process, or do we wait until the culmination of the process to give our opinion?
You want to take that, Mr. Powers?
Well, and I'll look to Tracy in
and
terms
Ms.
of additional
Noonan as well.
clarification. Right now, what's before the council is the issuance of an RFP.
Right. So to answer your question, Councilmember Jones, if you have guidance or direction that you think is important for staff to consider as they issue the RFP, then tonight is an appropriate time to talk about that guidance and those requests and suggestions that you have. For example, as Councilmember Engler talked about, he asked whether we would consider how far away, vendors' facilities are, and staff indicated yes, that would be a criteria.
Excuse me, I can't quite hear you. Could you maybe speak into the mic a little better?
Sure. Can you hear me now?
Yes, that's much better.
Okay, sorry about that. So if you have questions or guidance or suggestions on what you think would be appropriate for staff to consider in issuing this RFP and considering proposals to this RFP, tonight would be the time to talk about that. And as an example, I was mentioning Councilmember Engler's question regarding consideration of how far away a vendor's facilities are. Staff indicates that will be taken into consideration. So if that is something that's important, it's important, for you, that is something you can mention tonight as well.
Well, one concern I have is that we've always had some competition, not direct in the sense that somebody could step into somebody else's district. But originally we divided the city into 3 parts, and then a large company bought out 2 of the 3 and combined them. So now we have 2 parts. If this goes forward, in some of the conversations I've had with staff, I'm of the impression that it is felt that it may be more economical, and I don't know if there are other values that have been mentioned, to perhaps end up with one hauler for the whole city. That, I don't know if it's feasible to have districts as we had originally. But I've always liked the idea of competition. I don't like the idea of monopolies, just as a general principle. And I don't know if there's any sympathy for that notion on behalf of the other, or on the part of anybody else on the council, but it seems to me, as a general matter, when you get monopolies, sometimes that can lead to excesses and lack of, without a feeling of competition. I wonder if perhaps a situation can develop where we get less than the best of the one person or one company that may be involved. I know that the gentleman that was our consultant before spoke of the fact that San Jose, which I know is much larger now than Thousand Oaks, was divided into districts. Would it be feasible to in our counseling right now with the process, with our whatever input we might be giving tonight, to mention the fact that it might be wise to have more than one citywide district? Would this be the appropriate time to mention that if you wanted to, Mr. Manager?
Absolutely, and we'll have our consultant speak to those points and sort of why the recommendation is what it is right now.
Yes, this is Richard Tagore Irwin with R3.
Could you speak a little louder, please?
Yes, this is Richard Tagore Irwin with R3 Consulting, and our recommendation is really a single citywide service provider for the city of Thousand Oaks. It will give your residents, your business community, the best value. It will provide the least wear and tear on your streets. It will provide the best environmental protection for the city by reducing the number of truck traffic. It will provide an easier system for the city to manage a very complex contract. and it will provide a much better way for the city to hold a single service provider accountable and have the city in a stronger position for compliance with state law. So that is our recommendation, is a single citywide service provider. The competition comes from this RFP process. That's when you're going to get your competition.
Yeah, well, this may be irrelevant, but we have two very large electricity monopolies in California, PG&E and Edison, and they both just paid out huge sums of money because evidently instead of insulating their lines and doing all the things they should have been doing with whatever money they had, they paid it off in profits to their shareholders and so forth. And I don't like the idea of monopolies. I don't know if that has relevance to what we're talking about tonight, but just because you can have economies, it doesn't necessarily say, you know, do you follow my logic? Are you familiar with the billions of dollars that PG&E and Edison have paid out because of their lack of keeping their process, their lines, their equipment up to date? I think you're aware of that, aren't you?
So maybe I'll just jump in on one quick point of this. So as a reminder to the council and to the public, when you create a contract, especially a contract of this magnitude, it's built around performance standards. And those performance standards are carefully crafted with industry best practices that give Dr. Cox and the Public Works team the ability to manage the contract throughout the course of time. And in the comparison you were giving Councilmember Jones of inadequate maintenance of some element of infrastructure. We actually require performance standards on the quality and type of truck that's utilized as one example. And the service production elements, there are a litany of requirements that are laid out within the performance standards within a contract. In coming back to the question around competition, it's important to recognize when the council had an opportunity back in December to consider whether we wanted to do an RFP or not do an RFP, and we put forward the best negotiated rate that staff was able to get at that time. And once they and the council looked at that rate, understood there was going to be some increases, much of which was driven by the market. And the RFP was an option that was put before you as well. This is the first time we've done an RFP for this service. It is a significant service and it is an ever-evolving service. And from consultation with the industry professionals here, our main concern is ensuring the highest quality service at the best rate for our customers. And that best rate is spread across the broadest basis of households and businesses. And if we bifurcate, and in talking to the professionals on this, if you bifurcate that, then you are short cycling the market in terms of what you may be able to receive from an aggressive rate from the waste haulers. Mr. Finley, do you have anything to add to that, or Dr. Cox?
Thank you, Drew. I believe you covered it.
I have a follow-on comment.
Go ahead, Mr. Jones.
I obviously the comparison I made was not nearly an exact comparison. But, it seems to me that the State Utilities Commission should have taken a much stronger hand in analyzing the quality of the lines of the electric providers in California. But I think I hear the city manager saying that we would not let any their trucks or any of their equipment or any vital part of their service get into disrepair, that we would have the ability to step in if that ever happened. Is that right?
Yeah, that is correct on basically all aspects of the service. One other point that I did want to stress and mention, I think it was mentioned in the presentation, but it bears mentioning here. By doing a market-based look at this, we are not precluding operators from potentially subcontracting within this. And so in that scenario, we may see bids that involve, and we likely would anticipate bids that involve multiple subcontractors. For instance, we've long had street sweeping as part of our agreement, and that street sweeping has been provided by a subcontractor because it's not in the core business of one of the waste haulers. And so we would anticipate any proposals that we see will likely have subcontractors that could be on the waste, recycling, composting, or street sweeping or other elements of the contract.
I just wanted to add one.
Could we have in the contract that you could either bid on the entire city or part of the city?
So if I can answer that question. So the recommendation from staff is to bid on the entire contract. And I wanted to kind of touch upon the conversation and the comments that you made, Councilmember Jones, regarding what we currently have in the city. Right now, we currently have 2 operators that provide solid waste services to the city. And it is separated geographically in the city. However, I want to be clear, make sure the council understands that geographic distinction does not result in, for lack of a better word, competition among the 2 operators. In other words, residents who live in the geographic location where Waste Management provides services cannot contract with Harrison to come and provide those services because Harrison is in a different district. And I just want to make sure that council understands that there is no crossover among the 2 providers that we currently are under contract with right now. So in talking about your concern over monopolization, as a consultant indicated, the competition is really at the RFP process, is really about the RFP process, and it's no different than the arrangement and the contracts that we have with both Waste Management and Harrison right now.
Yes, Madam Attorney, I understand that you couldn't go into somebody else's territory. My thinking was more on the terms of if we went out for a shorter period of time and one, provider or hauler was showing up to be much better than another one, we might have the opportunity to give that person both districts if we had districts. That would be the only way that I would see competition. I realized you couldn't have a Waste Management hauler going and do a few people in Harrison's district or vice versa. My question again was, would it be possible or would the council be interested in wording the RFP that a company could bid on not only the whole city, but a part of the city?
Well, let's go to Mayor Pro Tem and see what she is thinking.
To answer Ed's question, if the council, if council wants to give direction, the staff recommendation is before you based on our work with the industry expert and consultant on here. If the council chooses to provide additional or different direction, we'll absolutely incorporate that, just to answer Councilmember Jones' question.
All right, very good. Mayor Pro Tem?
Thank you, Mayor Adam. I needed a refresher. How long was the contract going to be if we went after this RFP?
15 years with a possible 2 5-year extensions possible beyond that.
Okay. And say we encounter some problems with whomever we are choosing in the first 15 years, what are our avenues? How do we address? Will there be a clause to separate the city from this contract?
We have a number of penalties for smaller violations or for actions that can be corrected, and they will be listed in the contract. If there are major violations, that will be grounds for terminating the contract.
Right, we'll have the standard default and breach language in the contract in addition to the penalty provisions. So if there are significant performance issues or violations, and the city will have the option to terminate the contract.
Okay. And I'm actually quite relieved to hear Ms. Noonan explain, well, not relieved, but she made an obvious point that even though we have two providers in the city, doesn't really establish competition because of the separate districts. So I think that is very important. I think what Councilmember Jones is getting at is, for example, we have two providers for internet service, Verizon and Frontier, and one of them has been very problematic. The other one maybe not so much, and so, but as with the utility companies regulated by the CPUC, we don't have as much control over electricity or even the cable companies as we would have over the waste haulers. So waste haulers, we will have complete control over. The others are really out of our reach, and we have very limited input in that. And I do understand that it would make more sense to have one provider who will probably or likely subcontract some of the services to other providers in the area. And given the fact, as has been mentioned numerous times, that we have not gone out for an RFP in really since we started this is really crucial to get a better picture of the services available. I do believe that we owe it to our residents, both residential as well as commercial, to deliver to them the best price, the best service as well.
And Mayor
Thank you, Mayor Pro Tem.
Well, Mayor Pro Tem, if I might just add on to a couple of the comments that you've made, really, and you referenced the two areas of city that have had different providers. That's really emblematic of how this service has evolved over the course of time, in that we had legacy services, even what Councilmember Jones was mentioning in the early days of the city, with multiple haulers and the ability to select an individual hauler, and the world of trash, recycling, and now compostables is evolving pretty dramatically. And what's before you is really forward-looking, in that whoever comes in is going to have to make substantial investments in waste hauling, recycling, and composting in Thousand Oaks. One example of that, state's mandating new trash cans, and that'll have to factor in with a contract. And those new trash cans, you multiply out the cost of that associated with all the residential addresses and commercial addresses is substantial. So that length of time that we're talking about there, part of that is the attempt to get a magic formula to have the right rate structure to get someone to come in and bid with the best rate for our residents and our businesses, given the investments that they're going to have to make. That number of customers and that length of time in the contract are part of the magic ingredients to try to get the best rate.
Mm-hmm.
Councilmember Engler, did you have a comment?
Yes, thank you, Mr. Mayor. Really, I have just two questions. The comments I think we can have later as we have our discussion phase of our item here. One, I was relieved to hear and see that I have two concerns. One of them is the current employees of each company, making sure that those employees who have been servicing our citizens for all these years faithfully and well are also considered within our contract. And I understand that the current employees will be offered further employment with whatever contractor we hire for this task. Is that correct?
That is correct.
Thank you. And then in terms of the scale of the operation, is most of our savings that we could hope to get from this new contract that we have put in that bid? It's a very large amount of money over an extended period of time. Is the scale that we are offering with a single contract that where we're getting most of our our savings or most of the incentive for contractors to bid.
Let me take this. This is Cliff Finley. Actually, the length of time allows those capital expenses to be amortized over a further distance or amount of time, which reduces the overhead costs required on an annual basis. That is probably, and some surety for that contractor, knowing if I make an investment in Thousand Oaks and I follow the contract and I do a good job, I'm going to be there for 15 years, and that is worth significant cost savings to our residents.
So if we go with the single contractor with the extended period of time, then we would have our best chance of getting the least rates charged to our citizens?
That is what our industry professional recommends, and we believe that to be true as well.
Thank you.
All right.
Mr. Mayor?
Yes, do you have a question?
Yeah, what about the commercial? If we go with the recommended action here, will the citywide commercial be part of the contract?
Yes, it's included, all residential and commercial.
Because I know that I don't believe Harrison has any commercial right now.
Not in Thousand Oaks, but they do in other cities.
Yes, I know. I meant Thousand Oaks. So that what's on the table then is everything. And the idea is everything for one hauler, one company, all the residential, all the commercial. Is that correct?
That's correct.
Well, you know, I appreciate your talking about the economy and letting them advertise it over 15 years and everything. And so we would adopt a contract that would make it feasible for them to do that and get the best equipment and as Councilman Engler says, and use experienced haulers. I like that idea that he brought up, that people would be able to keep their work. But you know, you can think about this the other way around. They become very good. They become very well equipped and with everything. But the bigger it gets, the more we're also dependent on them. I mean, if we didn't like it, the bigger the contract, the harder it would be, wouldn't it, for some other company to come in and take over? Wouldn't it be easier if they could take it over in more than one section? I don't know who I'm asking that. Maybe it's rhetorical. I don't know.
It's a hypothetical question, but would anybody care to tackle that? Mr. Finley?
Yes. Yeah, we believe, Councilmember Jones, that though we like to believe that Thousand Oaks is a very large city, we are only a city of 130,000. And that is well within the means of any of our existing haulers to take over the entire city or not, and lots of other haulers out there as well. So we believe the size of our community, if we were dissatisfied with the hauler that's selected, that there will be plenty of other haulers that could come in and take over that work for us. They'd be happy to.
Cliff, do you think that we might get some indication of the accuracy of that, of your statement, by the number of people that we may get bidding in the instant contract we're talking about right now?
That's correct.
Do you have any idea of how many companies may bid?
Probably between 3 and 5.
Let me address that one. I mean, you've got, you're in a fairly strong market area, so there are multiple haulers, whether it is Waste Management, Harrison, Athens, CR&R, Republic, all of them are reputable and can provide provide a good proposal for you, and it really does enhance the competition that you're going to have going forward. And that is really the basis of going through a competitive process, is to invite as many companies as you possibly can into that process.
All right. Tell you what, if there's no further questions, we do have the speaker, and then we can go back to council discussion. How would that be? Let us go to our speaker then, and that is Mike Smith.
Hello, good evening. Am I on?
We hear you. Do we see you? Do we have Mike on video?
Okay, start.
Oh, telephone participation. Go ahead, Mike. We got you.
Okay, how about now? Am I on the video now?
You're good. We hear you, and that's fine.
All right, just got to get through the.
And now you're on video.
Okay, everybody. Well, good evening, Mayor, members of the City Council. My name is Mike Smith, the Director of Operations for Waste Management. I've had the pleasure of serving this community for the past 45 years. And as your primary waste hauler in the Thousand Oaks area, we do that with great pride. We've worked with each and every one of you on the dais, in previous lifetimes, Ed, and others for many years, and we've continued to work with, your amazing staff over the years and different city managers for so many years as well. And we respect your commitment to the residents and businesses of Thousand Oaks. You do an incredible job for the cities and the citizens over here. You work so hard at it. We like to think that we're right there with you. We like to feel like we're part of the infrastructure as well, and we respect the way you take care of the community, and we work for you. So we like to think that we do the same. We welcome the opportunity to highlight the great work that we've done over the past half a century, and with the plans for the future and the ever-changing world that we're living in today. Who'd have thought that we'd have experienced these things, at least in the world and in Thousand Oaks, that we have in the last 2 years. As mentioned earlier by Dr. Cox, there are many things that continuously changing in the state with respect to recycling, diversion, and processes. And in Sacramento, and we know those are going to be starting soon, and some have already started. There is no waste hauler in the country better equipped to do this than Waste Management. We've got the resources, we've got an incredible team, we've got the local resources in the landfill and recycling center. So we think we're in a really great position to move forward with the requests and the future demands of the city. And on a personal note, I've been 45 years with the company, which I say proudly. I've got all of my professional career here in this community working for this city. And I'm extremely proud of the partnership that we've had together with the city of Thousand Oaks, all the accomplishments, in our case, 80,000 plus pickups a week that we do in the city of Thousand Oaks. And we've seen the results of the city's surveys, and we're very proud to be partners with the city of Thousand Oaks, and we're looking forward to continuing that relationship. So we thank you for your time and look forward to working with staff through this process. Thank you.
Thank you, Mike. All right, ladies and gentlemen, we can now go to council discussion on this issue. Who would like to kick it off? We've already kind of discussed this, but we can continue.
Mr. Mayor, Bob Engler.
Yes, Councilmember Engler.
See if I get the first word in here.
Go right ahead.
I appreciate both our current our vendors, Harrison and Waste Management, have both been very responsive and very good for our citizens. However, as going back to our discussion a few months ago, this is a very large franchise that we are going to award. And in my opinion, we really have to put it out to an RFP to see what is the best deal we can get for our citizens. According to our testimony tonight, the best way we can do that is with one vendor who will be at least a master franchisee for the city. They can accomplish that goal however they want, hiring different vendors, however they feel like accomplishing that goal. But then we will have just the one vendor to deal with, And because of having them be our one vendor, we then can accomplish a scale of economy there that will allow us to get the best deal. I think that really is my bottom line. Will it give our citizens the best bang for their buck? I've got to go with our vendors and staff saying that this is probably the best way to do it. So I think I would lean toward going out with the RFP as presented by staff with a single vendor, as long as that vendor accomplishes the goal that we need them to accomplish over time, and they take care of the current employees and bring them along one way or the other. I want to make sure that all our bases, our employees or the vendors' employees are taken care of, and our citizens are taken care of at the same time. So that's kind of the way I'm coming down on it. I'd love to hear what my other colleagues have to say.
Is that a motion, Councilmember Engler?
Just discussion at this point.
All right, very good. I understand completely. Mayor Pro Tem, would you like to add in?
I would like to, yes, Mayor Adam, thank you.
Wonderful.
I think what makes this proposal for an RFP so strong, unlike other proposals. One second. Sorry.
You have a little friend with you. And there goes Mayor Pro Tem. Okay.
I'm back.
She'll be back, I'm sure. The dog ate my homework.
No, not yet.
Okay.
My apologies. What makes us different, and I think what makes this strong as well, unlike any previous RFPs the city has considered, Mr. Jones, I'd like to emphasize that to Mr. Jones, is that we will require, you know what, I'm sorry, I'm going to have to take a quick break, sorry.
That's all right. You go ahead, and why don't we go to Mr. Jones then? And Claudia will be back in just a moment.
Sure, I think I've said enough. I think my position is clear.
I would say so, yes.
I'm going to reluctantly, if there is a motion, I will somewhat reluctantly support it.
All right.
Although I don't like monopolies, and I know that we'll have conscientious, talented people develop this RFP, and the idea is to have it so airtight, or whatever the right expression is, that we'll have control over this. I ask a question: if we're not satisfied with any of the bids, I presume we have the opportunity to reject them and advertise again. Is that correct?
Yes, Ms. Jones, we do. However, if you recall, this is an RFP process, so we actually have the opportunity to negotiate with the vendor who is closest to us.
So we have input then with the various proposals that they make. Yeah. Well, I'm not going to speak further. I'm going to somewhat reluctantly vote for the RFP, and I won't reiterate my feeling about monopolies.
All right.
I think that's probably well understood by now.
All right. Well, we'll get a motion on the floor
Okay.
ultimately, and Mayor Pro Tem's back.
Yes, no, I'm right here.
Go right ahead.
I'm back. If I may, Mr. Mayor?
You may.
Thank you. Thank you, Councilmember Jones. What I wanted to say is that this proposal for an RFP is different from previous ones in that we will require whoever wins the bid to hire employees that are currently working in the industry locally here. I think that is very important. And then secondarily is that we will have complete control over the contract. We are not beholden to a state agency. We will have our own rules. We can enforce them. We can impose penalties if need be. So I think that gives me a peace of mind. I do understand with monopoly. I completely agree with you on that, Mr. Jones. In this case, I think it will behoove us to deliver the best service to the residents of Thousand Oaks. And this process, I hope, will do that. So with that, I would like to move staff recommendation.
All right. Thank you very much, Mayor Pro Tem. And I will just say that this whole RFP process is without a doubt in the best benefit of the residents of Thousand Oaks. It's met with considerable positive resident feedback as they have followed us through this process. If you recall, when we first started, because of all these new state regulations, we were all a little bit alarmed at some of the potential rise in costs for these services, and I think that's what prompted this RFP to begin with. But, you know, a request for proposal really is the definition of competition, and as you've heard, there could be as many as 5 haulers bidding on this. And when I listened to Mike Smith, I could see his competitive juices already coming to the fore. So I think the very process itself will ensure that the residents get the best possible service for the best possible price. And I really think the one contract is in the best interests of our residents. One responsible party that we deal with, and they may well subcontract. In fact, I would suspect that's what may happen. So we may end up with more than one hauler, but one responsible party I think is best for the city and best for our residents. And as far as accountability, that's the other thing that the RFP does. We can build in benchmarks for performance in an RFP that we don't have now, but we will have once this process is over, and that's going to ensure that we get great service. And the negotiability on these things is quite high. As the proposal is made, we can go through it line by line and look at ways that we can save money for our residents. So there's a lot of latitude there for us to get a great deal for everyone. So I would be in favor of the one contract, and I think we have a motion on the floor to that very extent. So if there's no further discussion, I believe we can vote on that.
Councilmember Engler?
Yes.
Councilmember Jones?
Aye.
Mayor Pro Tem Bill De La Pena?
Yes?
Mayor Adam?
Yes.
And that motion carries 4-0.
All right, thank you all. That is our primary issue for the evening. Let's see if our city manager has any follow-up.
Yes, thank you so much, Mayor Adam. This is our final meeting before our annual summer recess, meaning that our next city council meeting will be on Tuesday, the 25th of August. I do feel compelled just briefly to reiterate again after a few of the public comments on the front side of our meeting this evening. Obviously, I'm not a medical doctor, but I work extremely closely within our system of governance with medical professionals and public health professionals, and them and our local hospital providers are on the front lines every day, providing us with the data and the facts and the science behind what's happening. And it is an ever-evolving situation. When we look back to March, as we were combating COVID, we had very, very little testing. And now we've been able to test tens of thousands of residents and continue to be able to do so. And that number continues to grow capacity-wise. It's important that folks are focused on the fact and the science and the scientific consensus that is out there. And I think everyone's collective goal here as a society is to try to bridge ourselves back to a period of time where we can return to normalcy. And that's not where we are today. And so all of our actions, all of our focus, all of our collaborative efforts with our county partners and otherwise is aimed at trying to protect public health and trying to support our businesses and trying to bridge us back to a place of normalcy. You had asked a question earlier, Mayor Adam, about the Newbury Park testing facility.
Oh, yes, thank you.
Monday through Friday, 8 a.m. to 8 p.m. Is the times for that location. There is the closest drive-through location is over at Moore Park College. All the details on that are available online. So our next meeting, like I said, 25th of August. Obviously, that's a ways out, so our agenda is still taking shape for that evening. But just want to wish everyone a safe and happy month here ahead.
Thank you, Mr. Powers. And just to add to that, I'm stating what I think is the obvious. COVID-19 is a contagious disease. It is persistent, and it is on the upswing at the moment. It particularly affects seniors and people with vulnerable conditions. And it's just all of our social responsibility to do what we can to try to contain this virus, to protect people around us. And I think that we're all doing a fairly good job at that. And we may have to do it for a little longer than we thought. So let's keep up the good work. And now we have a closed session announcement from Ms. Noonan.
Yes, thank you, Mayor. We do have one closed session matter. It is a conference with legal counsel for potential initiation of litigation pursuant to Government Code Section 54956.9D4.
Thank you very much. And this evening, we are going to adjourn in the memory of a very good man and a friend of mine, Richard Williams. Richard was a prominent resident and leader in our arts community. He passed away on June 6th. He was a longtime community resident in Newbury Park, and he was a chemical engineer for Rocketdyne, but he spent his spare time serving as a member and past chair for the Rotary Club of Thousand Oaks, and he was a fixture at the annual Rotary Street Fair. And he dedicated his time to the annual Midsummer Eve Wine Festival, which raised funds to benefit the Ventura County Special Olympics. It was Richard's devotion to our local arts community that cemented his legacy as an invaluable and cherished member of our city. Richard and his wife Elaine were co-chairs of the Thousand Oaks Arts Festival. He believed that hands-on arts enrichment was a key component to a successful and strong community, and for more than a decade, the Arts Festival showcased the talent of Conejo Valley art and artisans. It was an annual event which was held on the grounds of the Civic Arts Plaza. It included visual artists, live performances, and art experiences for children. When the festival ended in 2016, the accumulated sponsored funds were reimagined by Richard to create an arts scholarship endowment with the Arts Council of the Conejo Valley. Richard was a board member and past chair for the Alliance for the Arts, and he organized a variety of events, including the Arts 5K Fun Run and golf tournament in support of arts education. He was also a key member of the transition team, which created the Thousand Oaks Alliance for the Arts. Richard's influence on our local art community will be felt for generations to come. We mourn Richard's passing and extend sincere condolences to his family, to his friends, and to his wife, Elaine. And I will say that Richard was a lover of the arts and a fierce and tenacious protector of the arts, and a formidable force here in the city when it comes to maintaining our arts and our art culture. And we thank you, Richard, for all that you have done for our city. And now we're going to adjourn this meeting. We'll be back with you August 25th. In the meantime, Enjoy the summer as best we can. Stay safe, and we'll see you in a month or so.